Hi, this is Dr. Tranchitella for Sunrise Functional Medicine, and I just wanted to share with you my own story about having an autoimmune condition. A lot of the patients that I treat have autoimmune conditions, and I quite often share my own story with them. So I know what they're going through. I know that it's frustrating. I know that you're scared. I know that you're wondering if you're ever going to be the same and not deal with pain and inflammation in your body. So back when, it was shortly after I graduated from naturopathic medical school, and we had taken a trip to India. And I acquired an intestinal infection there, not hard to do in India. And although the infection in my gut resolved without consequence, about a week later, I started to develop a lot of pain and inflammation in my knees and my hips. I also noticed that my eyes were red, and I thought that I had conjunctivitis, which I thought was strange, that I would get it in both eyes. And I tried treating that conjunctivitis with an antibacterial eye drops, but it didn't make any difference. And so as this went on, my knees started to swell up. They swelled up like the size of 2 grapefruits, and I started getting extreme stiffness in my hips. And I said to my husband, I think I have Reiters Syndrome. And, shortly thereafter, I went to a rheumatologist, and he indeed confirmed that I did have Reiters Syndrome. And Reiters Syndrome, which is known today as reactive arthritis, is a condition that can develop in those who are genetically predisposed after an intestinal infection. And so when I evaluate people for an autoimmune condition, I'm looking for specific triggers, which in me, it was an intestinal infection. And I'm considering what their genetic predisposition might be. In myself, I learned through this process that I did have a specific genetic marker, HLA-B27, that in the presence of a particular infectious agent could trigger an autoimmune condition. And so it was very scary at the time because my knees were swollen and I was very stiff and I couldn't move around very well. And of course, I was researching all of this and realized that those who have HLA-B27 may go on to develop something called ankylosing spondylitis, which is a degenerative condition of the spine. And I'm a very active person. I like to get out and hike and run and just generally be active in any way that I can. So I was very concerned that I was going to be living with chronic pain and chronic back pain and a degeneration of my spine. So having just graduated from naturopathic medical school, I took everything that I knew and started applying it right away. The first thing was I started treating my gut and dealing with potential food sensitivities, getting gluten out of my diet, getting dairy out of my diet, removing other potential allergens that could contribute to any kind of inflammation. I worked with a homeopath. I worked with botanicals. I worked with natural anti-inflammatories. And I really worked specifically on trying to heal my gut and remove things from my environment that could potentially trigger an immune reaction that could turn inward on myself. And so the process resolved probably in about 6 weeks. And 20 years later, I have not had a recurrence. And I never went on to develop ankylosing spondylitis, thankfully. And I really give thanks to the fact that I had the education that I had, and I didn't start down a path of just doing a bunch of anti-inflammatories, which would further destroy my gut function and lead to leaky gut and make that condition worse. So I jumped in immediately and I implemented fundamental naturopathic therapies, and I was able to resolve the condition within 6 weeks and never have a recurrence 20 years later. So if you are struggling with an autoimmune condition, using very foundational, fundamental naturopathic therapies can be very helpful in resolving or at least greatly improving your autoimmune condition. I know I experienced it, and I'm living proof that it actually works. So thanks for listening to my story. I'm Dr. Tranchitella.